Okay, everyone, we'll go ahead and get started here. Welcome to the third part of our 9-part series in emergency planning. This session will focus on risk management in emergency preparedness. My name is Mike Bittner. I'm a quality improvement advisor with Superior Health. I'll be facilitating today's call along with my Superior Health colleagues, Ellie Albers, Christy Fable, and Tony Kettner. I'll be introducing our speakers today. I just want to take a minute to review a few housekeeping items. We will post the slides several times throughout the meeting. Ellie's already posted them in the chat. Please feel free to add any questions or comments in the chat box. We'll be monitoring along as we go. We'll answer any questions at the end of the call. There will also be an opportunity to ask a live question at the end of the call, and we'll review that process a bit later. The series is being recorded and will be available on the Superior Health YouTube channel in about 2 weeks. This will allow you and your team to access recordings on demand when it's convenient for you. We'll post an evaluation link at the end of today's call. We'd appreciate it if you'd take a few minutes and complete that for us. We use the evaluations to improve calls and to determine if there are any other topics you could find informational or helpful. And at this time, I'll have Brian and Amy introduce themselves.
Good afternoon, everybody. Thank you for the welcome. Just in terms of introductions, a lot of you have been a part of these in the last few weeks, so you already have heard our introductions. But Brian and I are co-owners of Optima EP, Emergency Preparedness Consultants. So we do things like teach and educate, and we also assist with exercise design and conducting exercises. We also do things like plan and program reviews. So my background is as a HERC coordinator, again in Wisconsin. That is the Healthcare Emergency Readiness Coalition. In other states, it's simply called a Healthcare Coalition. In my background, the majority of my career was spent as a board certified chaplain in the emergency department and the intensive care unit. Brian?
Thanks, Amy, and welcome everybody. Amy and I really appreciate the opportunity to work with you folks through Superior Health on these important topics. Amy mentioned her background. My primary background comes from the field of public health. I've sort of dabbled in all things public health over the last couple of decades, up to the level of being a director health officer. So we come at preparedness from slightly different angles. We recognize the provider types and disciplines that are on the call today, and we'll try to provide scenarios and examples that are relevant to you folks, that you would see in your day-to-day operations, and how you would make sure that your facilities are as ready in terms of preparedness and response as possible. That said, we're going to jump into the objectives for today. We're going to talk simply about what risk management is. We're going to learn some strategies to mitigate risk. That mitigate term you're going to see pop up quite frequently. We will provide examples of several risk management tools that are out there. Some of the tools are going to be very specific to certain disciplines, although many of the tools are universal, meaning that any discipline or provider type, it would be beneficial and practical for them to use those tools. And lastly, and probably most importantly, is that last learning objective there. We're going to talk about how quality improvement really is the foundation, not only for this particular series, but for the previous 2 and throughout the entire series of 9 trainings that we'll be offering. We really want you to leave this with an understanding that emergency preparedness is nothing more than a fancy term for quality improvement. It's simply quality improvement in the event that a bad thing happens, so that you can respond and be more efficient the next time you have to activate. Amy, next slide. I don't know why I'm not seeing the advanced slides, but I'll rely on you for that, okay? In the world of risk management, you can see sort of the big 4 areas that we talk about. Your patient and your resident outcomes, that's in blue skies, as well as when incident or event is happening. There's always financial risk management. Everybody on the call understands the shortcomings and the pitfalls of financial risk management and the uncertainty as to where funding is coming from and the levels of funding. So we all know that that's an issue. Really important in emergency response is something called risk communications. And that is, how are you going to let your partners, how are you going to let your staff, how are you going to let the jurisdiction in which you reside, and how are you going to let the public know what's going on? In terms of after action reports and finding things that went wrong, communications always is number one. It's usually the number one thing to fail in an emergency response. That's why it's always considered a foundational component to emergency preparedness. But today we want to ground you on what we're focusing on, and that's that area circled in red. We're going to talk about hazards and vulnerabilities to your patient population based on what you provide, and the facilities and structures and resources that you have and can bring to bear during a response. Next slide, Amy. So risk management, we're going to start out complex and then we're going to get to the area that I like, keep it simple. But risk management really is identifying, evaluating, and then prioritizing. Prioritizing is a really key piece to when we get talking about hazard vulnerability assessments. You're going to hear Amy and I talk about your top 5. That's that prioritization piece. By coordinated and economical application of resources. So of the resources that we have, where do we want to put those resources to get the biggest bang for the buck? In order to minimize, monitor, and control the probability or impact of unfortunate events, or to maximize the realization of opportunities. So we're either trying to prevent something or we're trying to pour resources into something so that we're ready when that big bad thing happens. And then simply put, you can see what the heck is most likely to go wrong. And that's based on geography. It's based on your facility. It's based on the amount of staff that you have. There are many variables that go into that, and we're going to get into the tools that cover those specific variables. One other thing I think is really important to mention, we all know that 1,000,001 things could go wrong, and you can never pop to administrators or CFOs, people that control decisions on resource allocation. You have very good foundational evidence to show that this is a cost saving program, and it's well worth its weight in gold. Next slide. These are the 5 E's of risk reduction. We talk about education, and that really is your annual education and training plan. It could be some of the things that your staff need to maintain their licensure or certification. So that's that CEUs and continuing education piece. Engineering controls, this may be something that the people on the floor, the people that are working with your clients don't think about on a day-to-day basis, but your facilities people certainly do. Things like your HEPA systems, your HVAC systems, negative pressure or isolation rooms, clean rooms, engineering controls that you can put in place that without even having to think about it are already protecting you and your residents from unnecessary risks. Enforcement, that's when the big meanies come in, OSHA and other regulatory agencies, your safety managers, your emergency preparedness staff. Amy and I like to think of ourselves as the nice guys that come to help you before the big bad mean guys come in and issue citations. So our goal is to make sure that you're as prepared as possible. Along with those enforcement controls, there's those economic incentives and disincentives. So fines or citations on the negative side, bonuses, and or, this is a really important one, remember those cost savings for mitigating the impact of a disaster. because when you are responding to a disaster, you are losing money. Okay. And then finally, emergency response. We mitigate what we can, we prevent what we can, but of those things that we know that we can't control, how good of plans, response, and training can we have so that when those things do happen, we can shorten the bell-shaped curve of that response and therefore keep our clients safer, keep our residents safer, and not take such a hit economically. Next slide. The sixth one, Amy and I like to throw a 6th E in there, and this likens back to one of the last trainings that we had, and it was talking about culture. Culture is really important, and the most practical example that I'm going to give to you is this. Every staff person within your 4 walls should feel comfortable, should trust the environment and culture enough to be able to bring an issue forward. Without fear of retaliation, without fear of stay within your lane, those types of things. And some of the examples that we provided here are after 9/11, we all saw the national sort of the lingo of if you see something, say something. That's a culture. What is your reporting structure like? Are people afraid to approach administration or the superior above them and say, I see something that I think is incorrect or something that we could do better. Can we try that or can we address that? That is a culture of emergency preparedness. Remember, we're looking at processes. We're not looking at people. Okay. What are your visitor guest policies? Screening, identification. How and to what extent is your facility involved in the community at large? And that could be governmental, it could be non-governmental, it could be with light facilities within your geographical area, but how well do you know those key partners that you're going to need to work with? And then lastly, those family and individual plans, that really is ensuring or providing a safety net so that your staff are actually going to be there to help support that response. Because again, if your staff have to make a decision between coming to work and protecting their family, they are going to protect their family. Okay, next slide.
So this is the most common tool that we use to assess those risks, and that's called a hazard vulnerability assessment, or an HVA. If anybody's done an HVA before and really spent the time looking at the process, it can be a very painful process the first time that you go through it. But the value of doing an HVA and really dedicating the time and the conversation to it is that it does bring about very robust conversation, and it's a valuable tool. So it is an evaluation of the vulnerability compared to specific hazards that may be happening within your geography, within your local community. Obviously, the vulnerabilities that we have in northern Wisconsin are very different than even parts of southern Wisconsin or parts of Michigan or parts of the Twin Cities. It also varies by, we don't face hurricanes here, but we do face blizzards. So we have to make sure that the categories that we're reviewing are appropriate for the location that we are in. This does use a standard method to help prioritize and lift up what the priorities or the risks may be that your facility will face. And once you complete this process the first time, you will find that over time, the probabilities don't necessarily change that much, and the priorities don't always change. It has to do with how dedicated you are to the mitigation efforts and how connected you are to the community preparedness. So when you look at an HVA, and we're going to show you examples of that in a moment, there are several factors that get written into the formula, and you don't want to start messing with the formula. The formula is there for a reason. But the factors include the probability, So what is the likelihood of this event happening over the course of X number of years? How many times in 10 years are you likely to face this type of hazard? Then it looks at what kind of impacts could there be on human life? How many people could potentially be severely injured or actually die from this type of incident? How about the impact on hospitals or long-term care facilities? How about the community, the local public health agency, property and business? So infrastructure, as well as your ability to remain sustainable financially. And then it also looks at what kind of work have you done to mitigate and prepare, respond, and recover to the specific types of hazards or risks that you may face. What happens is once you plug all those numbers in, and again, we'll demonstrate that in a minute, you will get a numeric value that will give you a percentage of what the risk is. So for example, in our Northwest Wisconsin region, we know that there are certain risks that we are very likely to face. And one of them is blizzard or ice storm. And again, we've experienced that this year. And thankfully, that does rank high on our priority list. So we know that we need to continue to put money and time and training into doing whatever we can to mitigate or prepare for those types of events. This is a living document. It's not a once and done. And in fact, as we talked about last time, Appendix C makes the requirement, especially for skilled nursing homes, that you need to review this HVA annually. And the way that we do that in our HERC is we send it out for review to all of our members, and we ask for feedback, and they compare it to their own facility HVA, and then we open up a dialogue. Well, we really think that threats of violence should be higher this year, or we really think that issues related to climate change should be higher this year. And so we begin that conversation and we begin to work on our plans based on this HVA. Bottom line is we can't mitigate risk if we don't know what the risks are. So the reason we do the HVA is to help understand what it is that we face. What are those risks that we face in our facilities? So the categorization of most threats, there's basically three or four different elements. There's the natural disasters that can happen, things like weather or emerging infectious diseases. And again, remember that in Appendix Z, emerging infectious disease is something that must appear in your risk assessment. Whatever tool you use, that is a new requirement. There are human risks. Those are things like threats of violence, technological threats like IT, computer failure, cyber, and then hazmat. So anything that would be related to transportation or chemical or radiological types of events. So why do we have to do this? Because it fulfills the requirements. It's something that we're required to do by CMS, something that all of our joint commission. Did I?
Progress.
Okay. So it's something that we have to do just to meet our regulations. But again, the have to is based on the, if we don't have a basic understanding of this information, then we can't mitigate, we can't prepare, we can't do the things we need to do to keep our residents and our patients healthy. It helps us to focus on how we want to spend our money, our training, and our exercises. We want to make sure we're doing that. All of those things need to be tied back to our HVA. It defines where the gaps are. Sometimes we aren't aware of the fact that we really haven't put a lot of time into preparing education around our HVAC system until we do this process and really have an understanding from all the partners around the table that this is a gap for us. It gives us perspective on the broad type of events that could impact not just our facility, but the county, the community that we're a part of. And keep in mind that even though you may be required to be a part of a regional HVA, you are first and foremost required to have a facility institution, agency, organization-based HVA. And what you have in your facility is going to be different, perhaps, than what the region or the state has, because we have to take in a broader picture of geography and a broader picture of population type. So misery loves company, right? We are all required to do these HVAs, these risk assessments. So again, I would encourage you to sit in on the county-wide HVA, and maybe that happens in your local emergency planning committee meeting. It may be something that the public health department is sponsoring, but we encourage you, or your HERC, our healthcare coalition, to get involved, because the conversation that you're having with your local partners will help inform your organizational efforts. And again, you want to make sure that you're on the list, right, of planning partners, not only because CMS says you have to, but because it's the right thing to do. And it's because it will help inform your process and make you that much more ready and successful in your own HVA process and your own planning and mitigation process. So this is an example of a completed HVA, just the top things that rose to the top. This is, I believe it was based on our regional HVA in the last few years. The first one is the global infectious disease. Obviously, we were facing a global pandemic, and so that bubbled to the top as first and foremost in our minds. Along with that came pharmaceutical shortages. That ranked very, very high because we were dealing with a lack of vaccine. We were dealing with not having the antivirals. We were dealing with all sorts of pharmaceutical issues. And even in a non-pandemic time, we know that with RSV, with other types of influenza outbreaks, we don't always have the Tamiflu or even the child Tylenol that we need in order to protect our patients or our residents. Supply chain disruption also bubbled up because we were experiencing that, not only because of the hurricanes that had happened, but because of all the other things that happened with the global pandemic. And you can see how it's a mixture of the natural disasters, the technological disasters, as well as the human threats that we sometimes face. These are the very common ones that the Northwest Wisconsin region faces. And from year to year, sometimes they get moved around a little bit, but they still often remain in the top 5 or the top 10 hazards that we need to be thinking about. So when you're conducting that hazard vulnerability analysis, we want to make sure that you're pulling together a multidisciplinary team. You don't want just your administrator and your clinical director, your nurse director, to sit down and do this together. This is something that you need to have the director of nutrition, the director of your facility, the director of your pharmaceuticals, your pharmacy people, your therapy people, anybody that has a role in the leadership of your department should be around the table as you're working through this hazard vulnerability analysis, because they all bring their own lens and they all bring their own perspective of how they would be impacted if, for example, you lose power for an extended period of time. You want to consider all aspects of your facility, your unique population needs. If you are faced with a flood and you're in a skilled nursing facility, that's going to be very different than if you're a home health agency or a dialysis outpatient unit. So those types of population needs also need to be included in this. Geography, as we've talked about, community resources, again, the community culture. Are there language barriers? Are there access to transportation resources barriers? Are you primarily rural, or are you primarily urban or suburban? Those are all factors that need to be considered. As I said, the first time will be painful. It's not a process you can complete in 1 hour. It's a process that will take you days or a couple hours for several weeks until you work all the way through this process and give it the due diligence that it deserves. But after that initial year, it becomes much easier to review and consider a deep dive every 3 to 5 years where you're actually picking it apart, reviewing historical data, looking at, does this gut check feel right? Does it feel like this is the right hazard that we have been facing? They often don't change. I think we have a slide later that talks about if there's a very public media event, we have to be careful not to let that sway our perspective on the true probability of a similar event happening in our area. You will be given, you have to think through low probability, high consequence events versus high probability, low consequence events. Again, if there's been a recent mass shooting somewhere nearby, we tend to score threats of violence much higher, but it's really not a high probability event. It remains a low probability event, but clearly has high consequences. So we have to weigh that as we're doing our scoring. And then make sure you invite your county emergency manager. They really need to be your friend because they are your go-to people. When the emergency becomes overwhelming and outside of your four walls, that should be your first phone call, unless it's truly a 911 kind of emergency. You need to get in touch with that county emergency manager, tribal emergency manager. They need to understand what your needs are. And the more you can prepare for that, the better off you will be when the true emergency happens.
So what you're seeing on the slide now is an example of one of the tools that we often see, and we certainly recommend that you consider utilizing, and it's called the Kaiser Permanente tool. And what you see on the left-hand side, you see the different types of threats. And then on the top, going horizontally across, are all of the things that we've been talking about. What is the probability? What is the human impact? What is the property impact? Business impact? Okay, so this area that I just spoke to is really about impact. The next section is really about what steps are in place to mitigate or reduce the impact. So are there mitigations to lessen the impact in place? Do you have a very robust plan? If you have a robust preparedness plan that scores high, it's going to counter some of the negative impacts that could potentially happen from that event. In terms of response, do you have the ability to have a coordinated response? Are you able to pull the trigger on response in a timely manner? And then do you have recovery tactics and policies and procedures in place? As Amy mentioned, the formulas are already preloaded. So simply as you enter the numbers, it's going to calculate your risk score on the final column. Next slide, Amy. So we're going to break some of these columns down right now and just briefly touch on them. So the first one is, again, what are your types of hazards or threats? And you can see all of what we would consider the most common sense type things. One of the reasons that I want to emphasize what Amy talked about with the local emergency manager is part of their preparedness deliverables is having historical data of bad things that have happened. So if you're trying to look back and say, well, how many times has our area actually had a tornado? They have that historical information. Or how many times has this big bad thing happened? They are your go-to for that type of historical information. So don't feel like you have to dig through that stuff yourself. That information already exists within your jurisdiction. And that's regardless of whether you are a centralized state or a decentralized state. So for example, Wisconsin, very strong in home rule. Minnesota, you would be considered a centralized state. It doesn't matter in terms of what the emergency manager can bring to the table. As Amy mentioned, I'll just reemphasize that emerging infectious disease we're really seeing that replace the term pandemic a lot, although there are nuances between the two. You could have a pandemic of a very known disease. On the flip side, you could have 1 or 2 cases of an emerging infectious disease that could still be very, very high consequence. And then again, you have to consider who is your patient population. And the reason that I mentioned that is, again, let's say we have that emerging infectious disease, but through epidemiological research, we know that it affects a young population. Well, if you're in skilled nursing facilities or if you're in assisted living facilities, that's not necessarily as big of a threat to you because it's not affecting that particular demographic. So again, think about all of those different things as you're working through those different columns and rows. Next slide.
Yeah, I just want to mention one thing, Brian, and you'll
Yeah.
see on this list here that earthquake is listed. If there is something on whatever tool it is that you choose to use that does not apply to our particular geographical area, you can simply delete it. And if there is something that you feel is not on this list that you absolutely, because of your location, feel needs to be added, just add it. Just make sure that you're copying the formula down. As anyone who works with Excel, not me, I'm not good at it, but there are ways to do that. Go ahead.
Thanks, Amy. I appreciate that. Another thing to take into account is, do you have unique large events that occur within your area? I'll give you an example, the Burka Miner, okay, up in northern Wisconsin. They actually have that on their HVA. Why do they have that on their HVA? Because thousands and thousands of people are coming to that area for a very large scale public event. So be thinking about those things. You know, for example, let's say the Detroit Lions or the Green Bay Packers won the Super Bowl. It's a great event, but it also could be a potential threat. In Minnesota, they never have to worry about that because they don't have a professional football team. But you can see what I'm talking about in terms of local events. And Minnesotans, don't get mad at me and start throwing things in the chat right now because I'm actually a Vikings fan. Probability. So what is the likelihood of those incidents happening? Again, I would be going to local emergency management. They are they're your data geeks in terms of how many times these things have happened over the last 50 or 100 years. National Weather Service has really good data on, of course, weather-related events. And then previous after-action reports. If you consistently are writing after-action reports about real events that are linked to, let's say, IT failures, that IT failure is going to nudge its way up on your HVA. And administration may be wanting to look at what other resources can we throw at IT to start to mitigate some of those things. Next slide. This is impacts of risk. So you can see on a lot of these tools, it's broken down by where the impact is happening. So is there a human impact? Is there a healthcare services impact? What is the impact to the community? What is the impact to local public health? Because they can provide safety net resources and surge resources to your facility. But if they're severely impacted by the incident, now you can't factor them into the equation. They're not going to be there to be able to support you. What is the property impact? Do you have a continuity of operations plan in place so that if your property is impacted, can you continuity of operations transfer patients to a different location? And that's kind of a worst case scenario, but you do need to be thinking about those things. And then lastly, what is the business impact? If we can't accept patients, if we can't care for the patients that we have, you are going to have a significant business impact that is going to have a trickle-down effect to all of the other areas. Next slide. So we talked about risk. Now let's talk about ways that we can diminish that risk. And it really boils down to the 4 headers that you see on this slide. What can we do from a mitigation perspective, both internally and within our jurisdiction. Okay, so it's not only what you do within your four walls. By being a part of those local emergency planning groups, you can see what your partners are doing in terms of mitigation. So an example of that may be, you have a backup generator because you have to, but you don't have a plan in place for fuel resupply. But people within your jurisdiction might. So you can factor that resource in to your own HVAs. Okay? Preparedness. Again, how good is our training? How good are our preparedness plans? And how well do our staff know the preparedness plans? Can have the greatest plan in the world. Nobody knows about it. It's not going to do you a whole lot of good. And then again, how does that fit into the jurisdictional response plan? In terms of response, do you have the ability to identify triggers? Do you have identified the people that have the authority to pull those triggers? And on the flip side, how does the jurisdiction do that? And how do you communicate with them? And then lastly, recovery. We always include recovery because, to be honest with you, we don't do a very good job of recovery. Generally, what happens, what we see a lot in incidents is when the incident is under control, everybody just picks up their toys and goes home. Okay, we don't really have a methodical plan in place to get back to a state of normalcy. And that's becoming more and more of a priority in emergency response planning. Next slide. And then your final calculation, this is where the rubber hits the road. This is why you do the HVA. You're going to come out with an output at the end. And a lot of times these tools will not rank order. So what you see right now is what you'll get out of your particular tool. And you then simply take that data and put it in a different column or put it in a different document, and then you can rank order them based on highest to lowest. So there's the ability to be able to do that. Amy and I always talk about the top 5. Whatever your top 5 end up being, that flows into the training and exercise plan that you develop for your next cycle or your next budget period. And according to Appendix Z, your testing and training plan must reflect your top 5 threats or your HVA in general. So if your governing entities come in or your oversight entities come in and they say, show me your training plan for the next 2 years or the next year, whatever you have identified better be able to link it back to something that's in the HVA. That's very, very important. So some HVAs, we're showing you an example of an HVA right now that actually adds a couple of factors into their incident effect. And what we're focusing on this one is, does the big bad thing provide warning time? Okay, so an example of that would be, we know that the hurricane is coming, we have 4 days to prepare for it, versus that tornado that just dropped out of nowhere. Okay, so some of the tools that you see may have that in there. Just understand the rationale for why it's there. And then duration. Is this particular incident going to be chronic and cumulative and last for a significant period of time, or is it going to be very acute but intense? So again, other things that you can factor in. Those two impacts that we just talked about on this screen here, not a requirement for your HVA, but you may see that on some of the tools. Next slide.
So I want to emphasize what Brian just said. We've talked about a lot of the different kinds of impacts, the human, the property, the business, etc. Not every template or form that you use for your hazard vulnerability analysis is going to include all of those categories. It just depends which format you use. And again, it's really important to mention that CMS does not say that you must use the Kaiser Permanente tool. It, in fact, does not name what tool at all they want you to use. They just want to make sure that you are doing some form of risk assessment. So where do you begin? How do you find the tools that you want to be able to use for this? I don't know how many of you are familiar with this, this site. It's called Asper Tracy. Asper used to stand for the Assistant Secretary for Preparedness and Response, and Tracy is something like training resources, and I'm not sure what else, but it's basically a repository of tools and articles and policies and plans, and you can get very easily lost in this site because there's just so much information. It is run at the federal level, but if you go to this site, you can search specifically for hazard, vulnerability, or risk assessment. And then you come to this page where it's a topic collection. And you'll notice when you go on the Asper Tracy website that there are many, many, many different kinds of topic collections. But if you click on the HVA one, you'll see again, there's a sections navigation here, the things that you must read to understand what an HVA is all about, education training. And then over here, you do have the opportunity to see plans and tools. So again, there's probably more information you'd ever want to know about an HVA on this site. But if you're looking for a place to start, going to this plans and tools page may be a good first step. And I would, again, your emergency preparedness person, whoever is responsible for that within your organization as a job title, I hope that they're familiar with Asper Tracy. One of the best things about this is that if you are looking for something specific, so let's say that you have faced a specific hazard in your area and you've decided that you want to do an exercise on that topic, you can actually request technical assistance from Asper Tracy. You can put in your request and say, I would love to have 3 articles that talk about bomb threats in long-term care facilities. And the team at the federal government at Asper Tracy will do the research for you and email you back with the most appropriate resources as a place to start. It's free to join and become a member of Asper Tracy. There's no membership fees. If you have the ability to log into the site, it just opens up a few other avenues like the technical assistance, but it's a great resource. So again, make sure that you are familiar with this if that's part of your job description. Again, we cannot emphasize enough this diagram. And we've talked about this before. Prevention is something that we all are doing all the time, trying to prevent bad things from happening. Mitigation, what can we do to reduce that impact? But there will be times when we can't eliminate. We can't eliminate the risk of tornadoes or blizzards or extreme weather events or people walking into our facilities to do harm. And so when those things are identified through our hazard vulnerability analysis, we have the opportunity then to put things in place to help eliminate or prevent those things from being overwhelming to the point where it shuts us down. We want to be able to respond the best way we can to preserve life and limb and property, and we want to be able to get back to our state of normal. So this, again, is all about continuity, continuous quality improvement, where when we have a real event, we write the after action report. We look at how we can improve so that we're ready for the next year when the next blizzard comes, and hopefully we've improved our process. That slide should not be a surprise to you at this point. Any questions? I know last week we really rushed and ended up not having enough time because Appendix Z is just so big. But today we do have time. So if there's any questions in the chat, or I'll turn it over to you, Mike, to facilitate any further discussion.
It doesn't look like we have any questions in the chat. Does anybody want to jump on and ask live here? I've got one if nobody does.
I just wondered, Mike, if people could maybe chat in, how well prepared they are in terms of their hazard vulnerability assessment, or if they think that there's some opportunity for improvement and what that might be in terms of kind of looking at things from a more global perspective.
Sure. While you guys are working on that, just a quick question for Amy and Brian. Just looking at trends, since you guys have seen more emergency preparedness plans, are there any high, like, I don't want to say high ranking, but like high risk vulnerabilities that you keep seeing, or high risk hazards that you keep seeing over and over again?
Yeah, I think living in the upper Midwest, we're pretty used to the weather events, right? We know the blizzards, the extreme heat and cold are going to be coming. I think one of the trends that we are seeing is, and again, I don't want to open up the political debate about climate change, but when you look at the historical data of how we are seeing extremes, the extremes are more extreme, right? That whether that's drought or whether that's heat or whether that's going back and forth more quickly. We know if you look at the national trends that we have more and more expensive storms, right? And that's not just hurricanes, that is the winter weather that knocks out power and all those kinds of things. So I think, while at one hand I say that we're pretty well prepared for those kinds of weather events, one of the trends we are starting to see is that they are much more frequent and much more impactful. And that has to be taken into consideration. The other thing I would say that we continue to not be very well prepared for are those kind of random, person comes into our building and it's not just the gun violence kind of situation, but it's the domestic abuse situation where someone comes in to harm a staff member or family disputes. I think that is something that we don't feel we have a lot of tools to mitigate that. So that is something that I know we do see, as well as cyber. Cyber continues to be a major threat. And I don't think we have a full appreciation for how that can knock your business out of whack. If you get a ransomware, you can't access your printer even. That was one of them at a hospital we had, that it only targeted their printers, but they could not, they were paralyzed. And we think about the electronic medical record system and all of those things that are so integrated. I think that is, but on the one hand, it's a huge threat. On the other hand, there are a ton of resources. It's just a matter of understanding what they are and where you can get that assistance. Brian, do you want to chime in?
I would reinforce the weather piece. And I think the practical example I would give on that is there used to be a part of our country that they called Ice Storm Alley, and it was like the Tennessee, Kentucky. That's where traditionally those severe ice storms were. How many ice storms have we seen starting to lift north? It's happening more and more. And I tell you what, the response to an ice storm is much different than the response to a heavy snowfall. So that's one practical example. And as Amy mentioned, with either the cyber or the IT failure, one of the things that when I'm talking to a lot of IT directors, they're basically getting to the point where they're making sure that all of their key internet-based functions are not on one server. So they're starting to split servers, and they're starting to, for example, electronic health records has its own server. It's got extra firewalls, and they're making darn sure that it has offsite backup. So things like that, they know that cyber and malware are ahead of them. The bad guys always ahead. So what can they do to protect those things to the absolute max?
Thank you for that. And we do have a question in the chat. Is there a trend towards requiring satellite phones as a source of emergency communication?
It's funny that you say that, because we've kind of been there and it's gone away. And I don't know if it's circling back or not. The need for redundant communication is an absolute must. But I'm not sure that satellite phones are coming back into vogue. Brian, do you have a sense of that?
I'd really check with emergency management of your state, because I'll just be honest with you, Wisconsin has sort of been there, really pushed it, and it's sort of crashed and burned. There may be other states, however, that are continuing to implement and continuing to support it. And in that case, if it's functional and working, by all means, use the sat phones. But to Amy's point, as long as you have redundancy, there's nothing that specifically says that a sat phone has to be one of those redundancies.
Mhm. The other one that I would mention, if you have not done a prolonged power outage exercise, I challenge you to do one. And I'll give you an example. We had a nursing home that had parts of their generator that were requiring maintenance. And in order to do this, they had to shut down all power, including their generator, for, I think it was projected for about 3 hours. And their emergency preparedness coordinator had gone through the building. It took him almost a year to do this, but to identify every single piece of equipment that is energy, electricity dependent. And it was remarkable when we all know the HVAC systems and the computer systems, but he got all the way down to just the bedside equipment, the nebulizers, the things that patients and residents need on a daily basis. And they mitigated. They had backup battery power packs, and they had all of these kinds of pieces of equipment for this anticipated 3 hour in the dark. And the preparation work that they did with their residents to make sure that none of the residents were up in their electricity chairs, because they couldn't be moved if they were up when the power went out. So how, the inflatable mattresses, all of those kinds of things, they had to think through, what would we do in a prolonged power outage to keep our residents safe? And it was probably one of the best run exercises I've ever seen. And the power came back on before the 3 hours. But the contingency planning that they had to go through for this planned outage has set them up for success for when the next ice storm comes through and they lose power for 12 hours or more. So if you haven't done one of those exercises, something around that, boy, I encourage you to do it, because it was really eye-opening and a fantastic experience.
And was that brought on because of an event, or was that just something they got the idea for?
No, they had required maintenance that had to be done on their generator. And so they knew they had to do it. It was one of those things where it was like every 15-year maintenance, and they were due. So they decided to turn it into a massive exercise. And their residents were involved. Everybody had little bells to ring. It almost became a fun, highly anticipated experience. They brought all some of them, they were in households, they brought all their flashlights and did, kind of a pseudo, if you've ever been to camp in the summer, but it's raining and you can't have a campfire, you bring your flashlights together and put them in the circle and tell stories. They tried, the activities director was super involved, while maintenance and the power company people were doing what they needed to do in the generator. So.
Nice. Are there any other questions?
Mike, I wondered, as we're waiting for those, if Amy, would you mind advancing to this? There's a slide that I think.
Maybe one more slide.
Yep, my bad.
Thank
No,
you.
you're fine. Well, you guys if you have any other questions, or if you have answers to Tony's questions, please drop them in the chat. We'll get to them in just a minute here. But first off, all organizations should have a public health emergency preparedness plan that addresses emerging infectious diseases. Everybody's required to. If you are a community health partner, please complete this short 2-question form and let Superior Health know how we can support you in your emergency preparedness planning. If you're a nursing home, please complete this short nursing home form. It's a couple of questions. And then we ask you to submit your emergency preparedness plan. Please refer any questions to Tony. She's got her email address there. Otherwise, any of the Superior Health people that are on this call, please feel free to reach out to any of us. And then is there one more? Nope, that looks like it. Great. One last call for questions.
Mike, could I share 2 closing thoughts?
Yep, please.
Number one, you heard Amy and I talk about, whether it be climate change, but the fact that events are happening more frequently and they're happening for a longer period of time, to me, that screams emphasize your shelter in place or your evacuation plans. Okay, I think those are 2 areas that, whether we want to admit it or not, we may need to implement. That's one. And number 2, if you have to shelter in place and you lose power, and this is from a horror story of a real event, everybody has a generator for backup energy. Everybody has probably vendors identified for fuel resupply. So everybody's thinking, ooh, we got that covered. Real situation, the supply truck came to deliver fuel to the backup and the linkages did not connect. Okay. So very specific, unique situation, but if we can use that horror story for your facilities, guys, to make sure that your gas container has both the female and the male attachments, so that when that truck comes in, they are able to adapt and connect, regardless of how that truck is set up. I think that's another one that's just kind of an FYI.
Yeah.
And that's a good, this is why exercises are important, because you don't know what's not going to work until it doesn't work. It's better that it doesn't work while you're intentionally doing this than you find out on some cold night in November.
Exactly.
Also, I just noticed it started snowing here again too. So
On
right.
a holiday weekend,
Yes.
yes, at 2 a.m.
Yeah, exactly. And I'm sure everybody's at work and just raring to go there.
Yeah.
All right. Any other questions? Anybody? All right. Thank you, Brian and Amy, for the presentation. That was great. Thank you, everybody, for attending. Please feel free to reach out to us if you have any follow-up questions. Also, there is the survey or the evaluation form. Please fill that out. Thank you very much, and we'll see you guys in a couple of weeks.
All right. Sounds good. Thank you.
Have a good day.